We'll take a look at a post-operative chest X-ray and see what all findings we are able to make out from that chest X-ray. This is the post-operative X-ray which I was talking about. Have a good look at this X-ray and see how many of the findings you are able to make out. And after some time, I'll go on to the discussion with a labeled X-ray. I'm sure you would have made out most of the findings, even though only a short period was provided for viewing the unlabeled X-ray. The most obvious finding is the sternal suture wires. Then you can see the skin closure stapler pins here, a small pleural effusion in the left costophrenic angle, requires a little more observation. This is a little more of pleural effusion, more easily seen on the right costophrenic region. And this is also something which you will have to look for, but being a post-operative patient, you will certainly look for this, the ring of a prosthetic aortic valve. Then you can see the central line here coming from the superior vena cava into the upper part of the right atrium. This arrow marks the region of a translucency here. Most probably it is a pneumopericardium which is remaining after the pericardium has been opened. If it is a pneumomediastinum, I would have expected it to extend upwards also. So I think this is only a pneumopericardium. And another subtle finding is this. This could be the end of this catheter. The upper part is not seen. The external part of the catheter over the skin is probably what you are seeing here. Now, how do you differentiate between aortic and mitral prosthesis? You need a properly positioned chest X-ray, which is unlikely to obtain in an immediate post-operative period, because you see this patient is in the ICU with pleural effusion, pneumopericardium and central line. So otherwise, what you look at, there is a line connecting the pulmonary bay to the right cardiophrenic angle. You expect the aortic processes above that and mitral processes below that. Going by that, this should be considered as a mitral processes. But I know that this was a case of aortic valve replacement. That's why I said prosthetic aortic valve. Other findings seen on this X-ray are the tracheal air shadow, which is very well seen, right bronchus, which is more vertical, and left bronchus, which is more horizontal. Well seen on this slightly over-penetrated chest X-ray.